Welcome back into Everyday Kentucky. We're back here at UK HealthCare and Orthopaedics with Dr. Charles Mechas, who is an assistant professor of spinal surgery here. Am I close?
Yes, sir, that's perfect.
You're a hometown guy who's back here. First of all, what's that like for you to have grown up, have played sports here, and now you're in the process of helping athletes and others get back on the field or stay on the field?
Yeah, it's great. It's more than just a job for me since I grew up here, and so taking care of the people of Central Kentucky is really important to me. It's one of the reasons I chose to start my surgical practice here at the University of Kentucky.
Doctor, how has spinal surgery changed since you started your undergraduate road here at UK and medical school here, and then you went up to the Mayo Clinic? How has it evolved during that period of time?
Well, you know, over the last 2 decades, I think we're more in tune with the effects of spine surgery. And so we're coming up with alternatives, trying to do things more minimally invasive, things that shorten the length of stay for patients in the hospital. Also exploring things other than fusing. So a lot of spine surgery is fusion type surgeries, and some of the things we do are alternatives. And so myself and my partners here at the University of Kentucky do some of those advanced techniques, both in the neck and in the low back, to try to maintain patients' motion while decompressing their nerves and spinal cord or whatever they may need to optimize function and keep them as normal as they can so they can get back to work and do the things that they enjoy. You know what you can do. And I mean, you know you're good at it. And that's not bragging or anything, but how much of what you do now is kind of an educational piece? But because from my experience, it wasn't all that long ago that if they rolled you in here and you were up in a cath lab and they told you they needed to do something, you'd say, go ahead and do it. But if somebody said they needed to do something to your back, they'd get like 2-3 different opinions. Is that fair or not? I think it is. You know, what I always tell people in clinic, even if they're miserable, their leg hurts, their back hurts, their neck hurts, is that it's still elective surgery.
Right.
It's not cancer. I'm not going to save your life. I hope to improve your quality of life.
Sure.
However, it's still spine surgery. It's serious. It can be complicated. And I like to think we're good at what we do, but there's still risks associated with it. So most of the visit, when somebody has an indication for surgery, is spent explaining the risks, the complications, and the alternatives of surgery.
I think you can do an awful lot now with prevention. How do you know what prevention is good and what is not? In full transparency, I have a little tweak right here every now and then. So I was looking at some reels this morning, and it says, if you do these 4 things before you get out of bed, this will help. I mean, do those things work or not?
We actually see, for example, take cervical disc herniations. So disc herniations in the neck where there's a pinched nerve.
Right.
About 80% of those will resolve without ever needing any sort of surgery. And that's with physical therapy, maybe some injections, and time. So the body is a wonderful healer, and time is kind of the guide to healing. And so some people eventually do need surgery. But I would advise people to talk to your physician, talk to others, do your research before committing to doing anything. Because again, it's an elective procedure, and sometimes things get better with time.
Sure.
But when it comes to prevention, we know leading a healthy, what we call spine lifestyle, which means eating right, doing exercise, working on core strength, your back muscles, your abdominal muscles, all of those things can really go a long way when it comes to having aches and tweaks in your back and neck.
Is it fair to say that if we're looking at surgery, it's possibly going to be more for people that aren't athletes? I would think the people that are here on the basketball, the football team, things like that, they can work their way back in most occasions.
Yeah, the majority of people that we treat, although we do take care of athletes, both adolescents and college age and sometimes professional athletes, the majority of our patients are run-of-the-mill workers or even folks that are retired and
Sure.
of retired age. So that's the majority of spine pathology that we treat. However, talking about athletes, it is important because spine injuries can be catastrophic.
They can.
And so they're not as common, thankfully, as hip, knee, shoulder, or ankle injuries. However, it is important to consider the spine. And so we do see that adolescents are at risk for spine injuries, particularly in contact sports.
Yeah.
And so it gets a lot of media attention about professional athletes. Take the Ryan Shazier
Right.
Pittsburgh accident, for example. But there's a lot more kids playing sports than there are professional athletes. So estimates that are about 50 million kids are playing sports. So that's a lot of kids, and it's important to keep them healthy. And so injury prevention, especially spine prevention, is important. A lot of that in contact sports revolves around making sure that kids are participating with appropriate technique. And also you see policies. One of my favorite things on that front is in the 1960s and 70s is when people started wearing helmets for football. And that was to prevent head injuries. Well, what we saw is that people changed their tackling techniques and started spear tackling. Well, that led to an increase in spinal cord injuries.
Sure.
So now that we know that tackle technique is taught early, often, it's very, very important. And not to scare people, because at the end of the day, only 9 to 10% of spinal cord injuries we see are due to sports.
Gotcha.
So the vast majority are due to accidents, motor vehicle accidents, falls from height, and things of that nature.
Trying to pick up mulch when you shouldn't.
Yeah, so
Things like that.
that can hurt you, but that's not going to be devastating. And so for the average weekend warrior, stay fit, do exercise, work on your core strength, and that should be good. And for athletes, our sideline athletic trainers, as well as all our staff, we're all in tune to make sure that kids can stay out of trouble and stay out of our office.
Doctor, thanks so much for what you do. Welcome back. It's great to have you here. We
Thank you.
appreciate it. Remember, you can, whether you're a weekend warrior or whether you're a highly tuned athlete, you can get an appointment. All you have to do is go to ukhealthcare.com/ortho, and we'll see you next time on Everyday Kentucky.